Hey guys, welcome back to our channel Mother Baby Care. So today's video is about pregnancy myths versus facts, debunking popular misconceptions. So let's start this video. Pregnancy is an exciting and transformative journey, but it can also be overwhelming, especially with the plethora of advice and information available. While well meaning friends, family, and the internet often offer guidance, not everything you hear about pregnancy is rooted in fact. Let's take a closer look at some of the most common pregnancy myths and separate fiction from fact. Myth number one, eating for two. The myth: pregnant women should eat double the amount of food because they are eating for two. The fact: while it's true that a pregnant woman is nourishing both herself and her baby, this doesn't mean doubling caloric intake. In the first trimester, a woman generally doesn't need extra calories. By the second and third trimesters, an additional 300 to 450 calories per day is recommended. This is roughly equivalent to a healthy snack like a yogurt and a piece of fruit. Quality of nutrition is far more important than quantity. A balanced diet rich in nutrients like folate, iron, and calcium is key for both the mother and the baby. Myth number two: morning sickness only happens in the morning. The myth: pregnancy nausea and vomiting only occur in the morning. The fact: despite its name, morning sickness can strike at any time of the day. For many pregnant women, nausea can last throughout the day or happen in waves. Hormonal changes are primarily to blame, and symptoms often subside after the first trimester, though some women experience them for longer. To help manage it, small, frequent meals and staying hydrated can be beneficial. Myth number three: you can't exercise during pregnancy. The myth: pregnant women should avoid physical activity as it may harm the baby. The fact: in most cases, exercise during pregnancy is not only safe but encouraged. Regular physical activity can help with weight management, improve mood, reduce pregnancy discomfort, and even ease labor. Low impact activities like swimming, walking, and prenatal yoga are excellent choices. However, it's always important to consult with a healthcare provider, especially if there are any pregnancy complications or health concerns. Myth number 4: you can predict the baby's gender by belly shape. The myth: if you are carrying low, it's a boy. If you are carrying high, it's a girl. The fact: there is no scientific basis for predicting a baby's gender based on how the belly looks. Belly shape is determined by factors such as the baby's position, the mother's muscle tone, and the amount of amniotic fluid, not the baby's gender. The only reliable ways to determine the baby's gender are through medical methods like ultrasound or genetic testing. Myth number 5: avoid fish due to mercury risk. The myth: pregnant women should avoid eating fish to prevent mercury poisoning. The fact: while it is true that some fish contain high levels of mercury, many types of fish are perfectly safe and beneficial during pregnancy. Fish are an excellent source of omega 3 fatty acids which support fetal brain development. The key is choosing low mercury fish such as salmon, tilapia, and sardines. Pregnant women should avoid high mercury fish like swordfish, king mackerel, and shark. The FDA recommends 2 to 3 servings of low mercury fish per week. Myth number 6: heartburn means your baby will have a lot of hair. The myth: if you experience heartburn during pregnancy, your baby will be born with a full head of hair. The fact: while this sounds like an old wives' tale, there's actually a tiny kernel of truth here. Some research suggests that higher levels of certain pregnancy hormones can both relax the muscles at the base of the esophagus, leading to heartburn, and contribute to hair growth in the fetus. However, the severity of heartburn is not a reliable indicator of how much hair your baby will have. Many women experience heartburn regardless of how much hair their baby ends up with. Myth number 7, spicy foods induce labor. The myth: eating spicy food can help induce labor in the final stages of pregnancy. The fact: there's no scientific evidence to support the idea that spicy foods or other food based methods like pineapple or castor oil can bring on labor. While certain foods might cause digestive discomfort, labor is typically initiated by hormonal signals from the baby when they are fully developed. If you are nearing your due date and are eager to meet your little one, it's best to rely on advice from your healthcare provider rather than spicy food. Myth number 8, pregnant women should avoid coffee completely. The myth: caffeine is entirely off limits during pregnancy. The fact: moderate caffeine consumption is generally considered safe during pregnancy. Most health experts recommend limiting caffeine intake to about 200 milligrams per day, which is roughly equivalent to one 12-ounce cup of coffee. Excessive caffeine intake, however, may increase the risk of complications like low birth weight. Be mindful of hidden caffeine in tea, chocolate, and some soft drinks, but there's no need to eliminate your morning coffee entirely. Myth number 9, pregnancy lasts exactly 9 months. The myth: pregnancy is a precise 9-month period. The fact: pregnancy is typically 40 weeks long, starting from the first day of a woman's last menstrual period. This means a full term pregnancy is closer to 10 months. However, many women don't deliver exactly on their due date. Babies born anywhere between 37 and 42 weeks are considered full term, and due dates are merely estimates, not exact predictions. Myth number 10, you can't dye your hair during pregnancy. The myth: hair dye chemicals can be harmful to the developing baby. The fact: most research indicates that it's safe to dye your hair during pregnancy, especially after the first trimester when your baby's development is more stable. If you are concerned, you can use ammonia free hair dyes, consider highlights, or consult with your healthcare provider. The small amount of chemicals absorbed by the skin is unlikely to cause harm. Pregnancy is a time filled with excitement and anxiety, and it's easy to be swayed by myths and misinformation. While some myths have a kernel of truth, many are based on outdated or anecdotal beliefs. Always rely on up to date, evidence based advice from healthcare professionals and feel free to ask questions if something sounds questionable. Each pregnancy is unique, and what works for one person may not apply to another. So, listen to your body, follow sound medical advice, and enjoy the beautiful journey toward motherhood. So that's all about today's video. If you have any questions regarding this topic, you can ask them in the comment section. Like, share this video, and do subscribe our channel Mother Baby Care. Thanks for watching this video.